Hello, class. I'm your professor, Frank Henry Allah. Frank Henry Allah. And today we are going to talk about barriers to health equity. And our guiding questions will be, what are barriers to health and what is racism? So like usual, before we get into it, let's have a little bit of a rewind. So we talked about once before this concept of wellness and how wellness is an active process that we do in order to achieve health. There's different dimensions of health, as well as there's different dimensions of wellness to achieve those different dimensions of health. And so one of our goals is to come up with a plan and really to figure out how can we achieve health. And here's in the diagram, we see that there's 8 dimensions of wellness that can easily be transformed into 8 dimensions of health. We also learned that there are many different things that determine health, called determinants of health, or also known as social determinants of health. There's modifiable and non-modifiable determinants of health. Non-modifiable determinants of health are things that like biology and genetics, things that we are born with, and there's really nothing we can do about it per se, but we can go ahead and do things in life that allow us to at least manage those things that are non-modifiable. So we can at least manage certain things that are due to biological or genetic reasoning that determines our health. As far as modifiable things, we have individuals' behavior, which we talked about. Behavior is response to your internal, external environment or conditions. So these are things that we can go ahead and do in order to improve our health, like, to combat obesity, we can do more physical exercise, better nutrition, and so forth. We also have social factors. So things that are within our society that surround us, we are able to modify. Health services, we can improve the quality of service and care of our services. And also policy making, it's the rules and mandates and so forth that regulate our society that impacts our health, and also health disparities, right? Those differences among our health outcomes. If we could identify it as a preventable difference, and there's something that we can do about it. So we learned also about the socio-ecological model. This is really looking at of how an individual's surroundings impacts their life, right? There's a ripple effect that goes on. So you have the individual here at the center, and their health is impacted by the relationships that they hold, which is further impacted by the community that they live in, which is further impacted by societal, which is that policy and governments and things that regulate, right? And so the idea is that if we're trying to impact the individual, then maybe we can target the individual specifically, or we can target maybe the relationship like the family and the friends, or maybe we can target the entire community, or we can go ahead all the way up to societal level, and we can target the rules and regulations. And remember, at that level, at the societal level, when we're dealing with rules and regulations, that's considered primordial prevention, right? Public health has 5 prevention strategies, and one of them is primordial prevention, when we're using rules and regulations in order to prevent negative health outcomes. Also, I pulled this back out just to remind you all that in order to pass law, or really at every single level of government, we have these 3 different branches: legislative branch, the executive branch, and judicial branch. So we have this both at the local level, the state level, and also the federal level. Right now, we're looking at the federal level. And the reason why I bring this up is really to look at over here at this judicial branch. And I really want you to understand that depending on what president or what party is in place at the time that a Supreme Court seat comes available, that president nominates their they nominate someone to fulfill that seat on the Supreme Court. Now, understand that in the Supreme Court, that is a lifetime appointment. So that means that whatever ideologies or whatever views that current executive team, president, candidacy has in office at that time when they're elected, those beliefs get held throughout. Remember, we talked about whether or not someone's a conservative, liberal, or libertarian, right? So someone is conservative and they elect a conservative Supreme Court member, then what happens is those conservative views and values are held at the lifetime while that person's in office. So whenever whatever the Supreme Court says, that's the law of the land. So there's nothing within the state constitution that can contradict the federal constitution, which that's what the Supreme Court presides over. So whatever the Supreme Court says, that's the law of the entire nation. And rules and regulations have to follow that ruling. And we also talked about social justice. And remember that when it comes to social justice, one of the key things is really need to look at the foundation and the root of the problem. It's not just looking at the superficial level, but we really need to unearth and see what exactly are the problems, the reason why people are having these differences in outcomes, specifically when it comes to health justice, right? Why are people having these differences in their health outcomes? Why are people experiencing health disparities? So this visual right here shows that down here, when you're looking at the roots, right? If you're looking at the roots and the foundation of our nation or within a community or things like that, you can see that if there's poverty, if there's poor quality schools and so forth, and we just let that stuff fester and we don't address it, and then you add that with the trunk part right here, which there is no community support, right? There's no community resources. The community's fragmented, or there's disinvestment. There's no financial support within the community. So therefore, when you get up here to the area that's supposed to be blossoming like a tree, you see we have big impact of stress, obesity, all these negative health outcomes. So if we don't address what's in the roots of the issue, then we end up continuing the cycle of these health inequities that continue to ruin communities and so forth. But then when you look over here on the right side here, you see if we tackle what's in the roots, like provide the quality schools, access to healthy foods, access to healthcare, we really dig in the roots, you see that the community is then supported. There's participation, there's leadership, there's a social network that's built within the community. And then you see over here that even though these things still exist, stress, obesity, and so forth, all those negative health outcomes, you see that the community is still able to flourish. So, right, health equity is a goal and something we will always work towards. We may never fully achieve it, but it's something we could always work towards. And the more we work towards it, the better society is able to flourish, even if some of these problems still exist. Even the problems just aren't going to be as intensified and have as great as impact if we're able to buffer, in a sense, these negative outcomes. So it's really important when it comes to social justice, where you really look at what is the foundation, like how did we get here? Okay. And that's it for the rewind.